Hello and welcome everyone. We're all here today because we care about children's mental health. Specifically, hopefully you're here because you're a parent and you're wanting to learn more about their mental health and what you can do if something is going on. Even though the information we'll be talking about today does sort of specifically apply to adolescents, the information is really applicable across all age levels. It just looks a little bit different in younger kids. So today I'm only going to be covering the high points, but like I said, we will have plenty of time afterwards if you want to ask more specific questions. And again, you're welcome to put your comments and questions into the chat. I'll be keeping an eye on those. And my contact information will be at the end if you'd prefer to discuss something with me privately. So to begin with, I wanted to start with one of my favorite quotes. So this is a quote by Abraham Maslow. It says, in any given moment, we have two options: to step forward into growth or to step back into safety. And it's one of my favorite mental health quotes. Abraham Maslow, if you're familiar, his whole idea was Maslow's hierarchy of need, which the basic idea of that is we need our basic needs filled first: food, safety, warmth, rest. Those are needs that you make sure to fill as a parent. And then once you've filled those needs, then you take a step beyond and you're hoping to nurture their other needs. You know, you want to support their minds and help them grow. And that's what we're going to do today. So my goal today is to give you the information and tools you need to be able to identify when you have a child that's struggling and then how to help. So we'll be talking about some statistics to help you realize how extensive some of these issues are. Some things that could put your child at risk, because it never hurts to have more information. Some signs and symptoms that could identify when your child is struggling, and essentially what you can do about it. So specifically, when we're going to be talking about intervention, we'll be talking about changes you can make in your home, and then how to get help when you've sort of exhausted all the resources you have in yourself, in your home. So even though we will be spending our time primarily today talking about how to identify poor mental health and what to do when that's happening, I think it's important for us to start off with some basic knowledge of what mental health really is. And mental health is so much more than when we're struggling. It's something we all have. It's something we work on every day. When we've had a stressful day, so we decide to take a bubble bath or go on a walk, that's mental health. When we lose someone and we grieve, that's mental health. When things are all fine and dandy, that's mental health too. All of these things are mental health. And whether or not you're mentally healthy actually depends a lot on how you feel about your own state of well-being. So it's very personal, which is especially important to keep in mind when we're talking about our kids, because they may say something is stressing them out and you may not understand it. It doesn't matter, because it's important to validate everyone's experience. Everyone's experience is unique, and you've got to trust that they're really feeling what they say they're feeling. So one of my favorite definitions of what mental health really is comes from the World Health Organization. And it's one of my favorite definitions because I feel like it's really inclusive of what good mental health would look like. So they define mental health as a state of well-being where someone realizes their own abilities, can cope with normal stresses of life, can work productively, and is able to make contributions to our community. Us as adults, this is probably something we are still working to achieve. There are definitely times where we feel like we can't cope with the normal stresses of life, where we're not feeling 100% productive, especially during this time of pandemic. It's kind of uprooted everything. But it's still something, even though it's a goal we may never be able to achieve for ourselves 100% of the time, it's something we still need to work for. Because most of us will struggle with our mental health at some point. About 50% of us could meet the criteria for a mental health condition at some point in our life. So those are things like depression, anxiety, bipolar disorder, schizophrenia. That 50% number does not include everyone that will struggle with their mental health, just people with diagnoses. So that's all of us. All of us will struggle with our mental health at some point. As mental health isn't an on-off switch. It's more like a thermometer. There we have our good days and our bad days. There are varying degrees of mental health. And even those who have mental health conditions can reach that highest level of mental health. So keep that in mind. So just some more statistics. Remember, mental health conditions are very common. Half of us in our lifetime, and 1 in 5 every year. And the reason there's a difference in that number between yearly and lifetime is because some mental health conditions are lifetime things. It's something someone has on and off for their entire life, and some mental health conditions people experience in episodes. So they'll have them for a few months or years, and then essentially it'll be gone. And these stats apply to both adults and youth. The severity tends to vary by person, but most people with mental health conditions tend to fall in the mild to moderate side of symptoms. Only 5% of people will fall into what are called SMIs, or serious mental illnesses, and those are just mental health conditions that result in serious functional impairment. So things that keep you from going to work, things that keep you from holding down a job. And most of us are aware that the mental health needs of our young people have increased in recent years. There's a lot of speculation as to why that's happened. And the reality is we don't really know. Some people say it's social media. Some people say it's because of the expectations we're placing on our kids. Because let's be frank, they've got to do a lot, especially our high school students. But like I said, it doesn't really matter because it doesn't change anything. We can't do anything about why those numbers are increasing. But we can do something when our kids are dealing with these issues. So a great place to start when we're trying to get a firm grasp on how prevalent these issues are with our kids is looking at information. And luckily there is a survey. It's called the Youth Risk Behavior Survey, a handy piece of data, and it goes back years and years and years. So if you want to see an increase, I definitely recommend looking into it. But basically the YRBS monitors risky behaviors that our youth engage in, and it's an anonymous self-reporting survey. But according to the most recently available statistics, which I believe were from 2019, we know that in every classroom, and considering a classroom is a group of around 30 students, there are about 10 to 11 who meet the clinical symptoms of depression, 5 to 6 who have contemplated suicide at some point, 4 to 5 who have planned a suicide, and 3 to 4 who have actually attempted suicide. So never think, not my kid. That's probably one of the most common things I hear is, oh, not my kid, this couldn't have happened. Thinking like that keeps us from being able to realize when our child is struggling. So just keep in mind, even if everything is going well or it appears to be going well, it could be your kid. And mental health issues affect children of all ages. Half of all lifetime cases of mental illnesses begin by age 14, and 75% will develop by age 24. So those fundamental years of brain development. And the age of onset of mental health conditions varies pretty wildly based on the different mental health condition. So you can see with anxiety disorders, which are the most common disorders affecting 32%, that the average age of onset is 6 years old. And for those of you that are parents, it's probably no surprise. Anxiety is really common, and it definitely looks a lot different in kids than it will when they get older. But anxiety is very common. Then next we have behavior disorders, which for those of you that don't know what behavior disorders are, it includes things like ADD, ADHD, oppositional defiant disorder, conduct disorder. And then we have mood disorders, which include things like depression and bipolar disorder. And then substance use disorders, those affects about 11% of our youth. And the average age of onset is about 15 years old. And 40% of kids will have more than one diagnosis in their lifetime. It's not uncommon for someone to have anxiety and depression, to have anxiety and bipolar disorder, anxiety and an eating disorder. And another area that's getting a lot of attention right now is how the pandemic is affecting or may not be affecting our community's mental health. And I could spend a long, long time talking about the pandemic and the potential mental health impacts, but I want to try to cover the high points and what we know for sure and what is kind of up in the air. So what we do know is that along with the pandemic, there's been a lack of stability. There's been more isolation, which could lead to loneliness. There's potential illness. And there is some research coming out that coronavirus can have some psychiatric complications that can affect how your brain works. But not only that, the fear of becoming ill or knowing someone that has gotten sick. Most of us at this point know someone that has been seriously ill, and it takes a toll on our mental health. But looking at some numbers that sort of take that anecdotal information and give us something tangible to work with. So there is a system in Tennessee known as Essence. And basically what this system does is it captures information from emergency rooms, and it counts the number of times our kids are going into emergency rooms for suicide-related reasons. So that includes suicide attempts, intentional self-harm, and suicidal thoughts or feelings. It does not include suicide deaths. So it's only emergency room. It doesn't include suicide deaths. So in Knox County for this year so far, or I guess 2020, there were 16 weeks out of the entire year where the number of alerts we received was higher than last year. So we got an alert when the number of kids going into their emergency departments was higher. So 16 weeks. So 16 weeks where we had more kids going into the emergency room. Additionally, there has been a notable increase in mobile crisis calls in our area, increase of about 1,500 calls from last year. To date, there is no evidence that says the number of suicide deaths are increasing, and unfortunately, we won't have complete information about that until around 2022 because there's a few-year delay in suicide reporting information. And a few caveats with this information, the number of alerts could be higher because of the pandemic, but there also could be potentially a decrease in suicide deaths because we're around our kids more often. We're paying more attention. We see when they're doing things that are unusual and we may be acting on them. So that's potentially a really good thing. But we will just have to see in the next couple of years when those numbers come out what it's looking like in terms of the number of total suicide deaths. So it's also important to look at characteristics and life events that can put our kids at higher risk and things that can protect them from mental distress. Because once we know these factors, we can be preemptive about interventions like therapy. For example, I've got an adopted sister. She's 4 years old. She had a breakdown just the other day about her mom and why her mom isn't there. And my family is already talking about taking her to see a therapist. When you know those issues, you can get someone engaged in treatment earlier and outcomes tend to be better. So mental health conditions at their root are medical conditions that live in the brain, and how well the brain functions depends on two primary factors: genetics and the environment around us. Unfortunately, when we're looking at risk factors, specifically environment, it's one of those areas that can tend to make us feel a little bit icky because we kind of have to be hypercritical of ourselves and the type of environment that we're raising our kids in. And no one likes to admit their own faults and shortcomings, but if we're aware of things that are happening within our own home, then that can better prepare us moving forward. So first and foremost, if you or a relative has a mental health condition, whether it's something you're currently dealing with or it's something you've dealt with in the past, your child is more likely to have a mental health condition. Second, certain life situations can increase your child's risk. And tends to be the more of these your child has that are on the screen, these are known as adverse childhood experiences, the more likely they are to have a mental health condition or specifically deal with some sort of suicidal thoughts at some point. So it can include traumatic events like abuse or neglect in the home, if they have an incarcerated relative, if there's substance use, if there's domestic violence. And trauma can also include things that happen outside of the home, such as natural disasters or bullying. And, and unfortunately, the persistent presence of stress chemicals basically leads your child's brain when it's developing to form unhealthy habits. And those unhealthy habits get stronger and stronger and stronger the longer they do them. But during childhood, it's the brain is also really plastic. So then is the time to sort of jump in and break those habits. Whereas if they keep doing them into adulthood, a lot of those habits become solidified. And we want our child to have a good foundation for future life. And unfortunately, there are a lot of those risk factors that we have little to no control over. We can't control natural disasters. We can't control whether or not they're being bullied in school. And it is important to be very self-aware of our own abilities as parents and continue working on them. But the last thing I want you to do is to beat yourself up over your slip-ups. Lots of us on this call had things that we experienced in our childhood that we could probably identify as less than ideal, and we turned out fine. So we're only human, and we've got our issues we're dealing with, and sometimes that trickles down with our families. The fact that you're even here means you care about your children. So that is the most important thing. So hypothetically, let's say our child has had multiple risk factors, but maybe they're not showing signs or symptoms yet. What we want to do is try to build their resilience, or basically their capability of withstanding future stress and catastrophe. So trauma breaks down their foundation, and we want to go in there with some concrete and, make it solid, make a good foundation. So first and foremost, having close and healthy relationships is very important for childhood mental health. Those can protect you. You can't build their friendships, but you can work on your relationship with your child, and we'll talk about how we can do that specifically related to mental health. Other protective factors include having a positive view of self. That's something you can help with too by giving your child compliments. The ability to manage strong feelings and impulses. You might not be able to control how they deal with things, but you can model how to deal with them in healthy ways. Solving problems, having good communication skills, feeling like they're in control, and the ability to find positive meaning in your life despite traumatic events. All of those things help build our child's foundation. So despite all of the things that are happening around them that are trying to beat down that foundation, if they have these things, they are more likely to succeed and less likely to deal with any serious mental health issues. So as all of you have a child in high school or are an employee or work in Knox County schools in some way, it's incredibly likely that if your child has a mental health condition, they've already begun exhibiting symptoms, because remember, it was 50% by age 14, and that's high school. So symptoms of mental health conditions, they are not occasional things. They are changes that are long lasting. So if you notice them exhibiting any of these symptoms for almost every day for 2 weeks or more, it's time to intervene. And I will say that with a couple caveats. And that is, if your child is engaging in any form of self-harm, or you're worried they are suicidal, you don't wait 2 weeks. And also if they have experienced recent loss in their life, because grief responses are normal and healthy, and they do not mean that someone has a mental health condition. If someone is still experiencing the same intensity of grief months later, that's when it may be wandering into mental health condition territory. So first we want to look at physical warning signs. These are things you can physically observe and tend to relate to your child's physical health. So changes in eating, and that can be a lot of different things. It can be more eating, it can be less eating. It could also be an obsession with eating healthy. Just because someone is at face value getting healthy doesn't mean the reason behind it is. So pay attention to those things, sort of tuck it away for later. And when it exists with other things, then it could be a sign. Changes in sleep, that could be sleeping too much or too little, not being able to fall asleep or stay asleep, or even new or persistent nightmares. They may also have changes in their energy levels, so they may seem fatigued or tired. If they report new aches or pains, that can include headaches, migraines, stomach pain. Reports of stomach pain are especially common for people with anxiety, feeling like they might vomit, or other physical symptoms without the presence of a physical illness. And physical complaints related to mental health concerns tend to be more vague in their description, so that's something to pay attention to as well. Some other emotional and behavioral signs, if they have new or increasing anger. And I do want to say specifically with some of these symptoms, there does tend to be a difference in male and female expression. When male adolescents are uncomfortable mentally, they tend to externalize how they're feeling, and female students tend to internalize, but again, it varies sort of by person. So if your child becomes more aggressive, stubborn, hostile, or prone to outbursts, also pay attention to their grades. A downswing in grades definitely can be a sign, but also something you may not even think about if someone has a sudden increase in their grades. That could potentially be a sign as well. If your child shows difficulty concentrating or focusing, avoidance of certain people or places, or just avoidance of people in general. And with this, being a loner is not the same as having a mental illness. If your child has always been isolated, that does not necessarily mean they have a mental health condition. If they, for example, my sister, she had a long history of mental health conditions, and in high school she had her small group of friends. But she went from having her small group of friends to never hanging out with them and just staying in her room. So you want to look for that change. There also may be changes in their physical appearance. For example, if they stop showering or bathing themselves, or even groom themselves more. Change in the appearance can also include a change in the type of clothing that they wear. So pay attention specifically if they always are sure to have certain parts of their bodies covered, like their shoulders, or the tops of their legs. Those are common sites for self-harm. So if your child used to always wear tank tops that showed off their shoulders, and now they're always wearing sweaters, even if they go just below their shoulders, again, tuck that away and save it for the future. New or more intense use of a substance to cope. And when I say this, I don't just mean illegal substances. Medications that are prescribed can be abused, and medication or drugs can also include things like caffeine. We go into schools quite a bit for the Mental Health Association. There are so many young people that are completely reliant on caffeine. Other risk-taking behaviors, isolation, new or recurrent fears, persistent sadness or frequent crying, if they start having panic attacks, or self-harming behaviors. And I don't have time to get into self-harming like I would really like to, but if you have any questions, or I'd be happy to do another presentation as well that can really do a deep dive. So you may be looking at those symptoms and thinking, oh my goodness, that's my kid. Or maybe you're thinking the behaviors you're observing is just teen angst. So we'll walk through a few points to help you realize the difference between the typical teen growing pains and what might actually be a mental health condition. So there are 3 points you want to look at. You want to look at intensity, duration, and domains. Intensity. Do the symptoms come and go, or are they more persistent? Are they mild but chronic? Are they interfering with school, home, or their social life? Are they so disruptive that your child doesn't want to get out of bed? That is a mental health condition. But if they come and go, it may not necessarily be. Second, duration. Does the moodiness come on suddenly and is gone moments later? Is it followed by days where everything is okay? Then that's probably teen angst. But if the moodiness is more chronic, lasts for longer periods of time without breaks, then likely something bigger is at play. And lastly, domains. Even if your child is acting out at school or home, more than likely they'll straighten up when they're around their friend group. If the issues are persistent across every domain of their life, then it's more than likely a mental health condition. So if you notice any of the signs of a mental health condition, the sooner you can get your child help, the better. Ultimately, you can make their healthcare decisions for them, but the outcome is always going to be much better if your child is a willing participant. So the only way I would ever proceed with sort of making that decision for them is if you've exhausted all other options. So step one, the best intervention for kids that are struggling with their mental health is actively engaging in prevention efforts ahead of time and ensuring conversations about mental health are normalized. So first and foremost, model sharing your emotions and talking about the challenges in your own life positively. Show your child it's okay to talk about your feelings. If you struggle with a mental health condition, please don't be afraid to disclose it. Of course, disclose what you're comfortable with or what you think is appropriate, but your child has likely already noticed something is going on. And by not talking about it, you're sending a very clear message that mental health is bad. It's something you need to be secretive about and afraid of. Oftentimes, the things we don't say are more powerful than the things we do say in these situations. Ask questions when nothing is wrong. So ask your child questions every single day and make sure you're asking open-ended questions that are specific. So instead of asking, how was your day? Ask, what was your favorite part of the day? Or what was something that was difficult for you today? Be open and honest about how you're feeling about your own emotions. It'll be more likely for them to open up as well, even if it means being vulnerable, self-deprecating, or even prideful about what you accomplished during the day. And there are things that you can incorporate into your daily family life that are good for everyone's health and will set you up for success. First and foremost, don't underestimate the importance of getting a good night of sleep, having a healthy diet, and getting regular exercise. I can guarantee you, I always tell people, prioritize your sleep, make sure you get good sleep in at night, and everything else will fall into place. It's not going to be perfect, but it'll be much, much easier. Create a consistent routine whenever possible. We find a lot of comfort as people in routines, knowing what's going to happen and when it's going to happen, especially for people that struggle with mental health conditions. Routine is extremely comforting. Make sure to create a sense of belonging. Remind your child that they're important and they're valued. You may think they know it, but it never hurts to remind them that they're loved and point out positive things that they've done. So this may mean complimenting them for their creativity, their thought process, or even maybe they did a small gesture for their sibling, and make sure you acknowledge that. Also be sure to plan intentional time together. I'm not talking about plopping down on the couch like you normally do and watching the next episode of the show. Intentional time doing something together where you can engage and talk. And also gives you an opportunity to potentially notice warning signs. And lastly, promoting resilience. So remember, resilience is the things we walked through earlier, because challenges and adversity are natural parts of life. And the way we respond to them in our own life will directly affect how your child responds to challenges that you may face. I mean, my mom, she's obsessive about her to-do list. I'm obsessive about my to-do list. Kids learn things like that. And so be open with how you're responding to things and try to learn healthier ways of addressing the feelings in your own life, because your children will pick up on that. One thing I want to address too is the loneliness and isolation that comes along with virtual learning and the pandemic. Loneliness is a complicated subject. And there's not a one-size-fits-all answer to loneliness because loneliness is such a personal experience. You can be surrounded by people and still be lonely. So there are kids in school that are feeling lonely. Essentially, being lonely when you experience that feeling means you're not getting that meaningful social connection. And that meaningful social connection can't be met by just being around someone else. So, but it is worth noting that when someone has persistent loneliness, um, it's likely that they're dealing with something more than just loneliness. It can very well be a mental health condition that makes it a lot harder to feel those same feelings that you do with meaningful social interaction. So there are a few things we can do to address these feelings of loneliness in our kids, especially those that are learning virtually. Some of these you may be able to facilitate. Some of them you may need to talk with their teacher and see kind of what maybe you could work out for the class. Don't be afraid to ask someone for help because I can guarantee you your teachers are as concerned about your child's mental health as you are. First and foremost, it's important for your child to have peer interactions outside of the virtual learning space. And by virtual learning space, I mean the virtual classroom. They need to have some sort of interaction that is not facilitated by adults. As scary as that may be, they need to have that time where they can be open and honest. Also, kind of switching it up can be a good option. We're all kind of dealing with the Zoom fatigue, as it's called right now. Switching it up and maybe even writing letters or making phone calls can be a good way to change things up and potentially get some of that meaning back in social interaction. And find ways to connect despite the difference. I know something that we've been doing with my work team is I've been sharing prompts every week. It's just one little thing about yourself. So, one week it was, what's your Get Pumped song for this week? And we all shared YouTube videos. And it could be, what's your resolution for the year? Or around the holidays, it was, what's your favorite Thanksgiving side dish? It's little things that help you feel more connected to each other. And another way to deal with feelings of loneliness is by giving back. It always is such a great feeling taking some of yourself and giving it back to the community. And a great way to volunteer now in this time of social distance is working with animal shelters, because animal shelters are actually actively need fosters specifically for adult dogs. So it can be a great way to have your kid engage in some sort of activity that gives them more responsibility. But also it's a great way to give back to the community. I personally foster with a few different organizations in the area. So if you want any information on how to do that, you can just reach out to me directly. Building your home into a place that is more mentally friendly doesn't just benefit our children, it benefits us. So it's something we've got to continue working on. So let's say we've done all that. Let's say we're at the point where we're noticing some of these symptoms. There are a variety of reasons why your child won't actually come to you and talk about their mental health. You could have created the perfect environment, but I like to call mental illnesses. They're great liars. They tell you that no one loves you and no one cares about you. Your brain is telling you these things and you really truly believe them. So you may have a fear that someone will judge you or that they won't understand or they won't take it seriously. And so they may mask and pretend like everything's fine or just not talk about it. So sometimes you have to make that first step and start the conversation. First, just know that when you're talking to your child, talking about what you've seen and what you've noticed, what's troubling you, just having that conversation can have a really good impact on your child's mental health, because sometimes they just need to know that they're seen. They need to know that what they're dealing with isn't being ignored or overlooked. Creating these spaces and having these conversations is going to be very beneficial in the long run, although it's important to truly listen when these conversations are happening. So when it comes to mental health, the words you use are very important. Choosing the wrong words can leave your child feeling stigmatized or shut down. With that being said, it's really hard to know exactly the right words. Even someone like me who does this for my job, it's a lot different when it comes to a personal situation and knowing the right words and the things to say. So what I can tell you is the right way to approach the situation. Don't worry about the nitty gritty of the words. Worry about how you approach it. So always start from a non-judgmental and caring place. Realize that even though you were your child's age once, you don't know what their experiences are. Don't make any assumptions about what they're feeling. And then try to stay hopeful. When someone's struggling with their mental health, hope is really hard to hold on to. And start with the little things to set the conversation up for success. So make sure you're not preoccupied with something else or multitasking. Make sure your child is getting your full attention, including eye contact, and make sure you're really listening to what they say, not thinking about what you're going to say. I think we all get in the habit of that sometimes. And when I say really listen, I mean listen to their body language as well. Generally, you'll start by telling your child you've noticed some difference in their behaviors, you care about them, and you're concerned. Always approach it from that mindset of I care and I'm concerned. Don't label the process and bring up, oh, I think it might be anxiety or depression. That may leave your child feeling labeled and confrontational. So a good conversation starter is, I've noticed XYZ. What's going on? And you know, they may not want to talk to you. That is completely okay. Understand that the conversation may be uncomfortable for everyone. Kids, they're used to talking about mental health a lot more than we were, but they are not super comfortable about talking about it with adults. So, you know, especially from our end, we don't like feeling vulnerable in a week, and that's all that mental health is. But having and starting these conversations can create a more welcoming environment. So when you start these conversations, try not to expect an immediate connection, even in the past if your child is really open with you. Remember to be persistent, don't give up on the conversation or paying attention to your child. And like I said, it's okay if they don't want to talk to you. You can ask them if they prefer to talk to someone else. This can open up the door for potentially talking to a counselor or some other type of therapist. Some things we want to avoid when speaking with our child is using patronizing or punishing language. Typically, young people with mental health conditions end up feeling in a space where they feel like they're alone, they're doing something wrong or in pain, but can't figure out why. So being called dramatic or you're doing it for attention, add fuel to the fire and make them feel more cut off. It's not fair to punish your child for suffering. It's also important that we don't push our beliefs or assumptions onto our children. So when we try to rationalize what the child is going through or tell them why they shouldn't feel a certain way, we invalidate their feelings. And those can increase those feelings because it basically reinforces something is wrong with you. So then they'll just put their walls up again. So you want to create that safe and open environment for your child. Understand that your child is an individual, as are their experiences, how they perceive their experiences, and what they need to cope in a healthy way. For a child struggling with their mental health, sometimes all they need is a change in their routine or home life. I know parents that have moved their children to homeschool, and it was the thing that child needed for their mental health. But in those moments, basically you need to do what's best for your child. Sometimes all they need is self-care, but because mental health needs exist on a spectrum, everyone experiences it differently. So first and foremost, starting with self-care and coping, and those are the things we've already talked about, like having a daily routine, getting a good night's sleep, having positive social relationships. When self-care and coping alone don't alleviate symptoms, then the next step is usually checking in with your child's primary doctor. And one of the reasons I say that is because there are physical health conditions that mimic mental health conditions, specifically thyroid disorders and anemia. Both mimic depression. Especially a lot of us women on the call, we have thyroid disorders and have noticed times when we felt drained and exhausted. And feeling drained and fatigue is one of the primary symptoms of depression. Then lastly, sometimes when you talk to your primary care doctor, they can point you in the direction of seeing a counselor. Sometimes there are counselors in your doctor's office, which is great, the one-stop shop. But it's important to do research on therapists to find who's going to be the best fit for you. Therapy is not a one-size-fits-all. There are different types of therapy and different types of therapists. If it's something your kid is engaged in, it can be helpful to have them help you do research and read all about the different therapists. If you go to private practice websites, they'll usually have bios of therapists, and they can do research into type of therapy and figure out who they think is going to be best for them. But remember, when your child goes to therapy, there is a certain level of confidentiality expected. Don't expect your child's therapist to tell you everything your child says, nor should they. If you have a therapist that's telling you everything your child says, you need to find a new therapist, because that means they're breaking some serious ethical guidelines. Medication is also generally recommended for children who are going, or teenagers who are going through therapy. I recommend you do research and figure out what's best for you. I am always willing to sort of talk you through that and figure out what's best for you. Also, don't be afraid to ask your child what they want. I was once in a school that is on this call and had a child come up to me and said, you know, I want to be on medication, but my dad is telling me I need to wait to see this person. And he's like, I can't do this. Like, I need to be on medication now. I can't wait to see this renowned psychiatrist. So pay attention to what your kid needs. Recovery from a mental health condition is not one and done. It's an ongoing process. Don't pressure your child to be normal. Learn to appreciate and accept their new normal. Because even though mental health conditions absolutely can be debilitating, they don't have to be. And how you react to and to support your child can make a big difference in their long-term success. Use all the resources you can. And so I am going to send out a resource guide to all of your counselors, which they'll send out to you. Hopefully it's got a good summary of some of the information we talked about today or tonight, and this information as well. But here's just some brief information. My name is Caitlin, and that's my cell phone number, the 901 number. Or you can always call our main office line to just get general information or referral. Always feel free to call your school's counseling team for help on this. I can guarantee you they have a list of therapy resources in your community that they can refer you to as well, and they can support your child when they're in school. It never hurts to have someone on your child's side when they're in the classroom. Here are some private practices in the area, specifically for the middle path and Bearden Behavioral Health. If you have any issues at all with them, feel free to get in touch with me personally, because we have their execs on our board of directors. So we've got a good connection with them and can help connect you or if there are any issues. And lastly, some crisis numbers. Don't ever be afraid to call crisis numbers. The Suicide Prevention Lifeline is great. Mobile Crisis is great. Though be aware with Mobile Crisis, it's something they won't be able to do likely immediately. They try to be out there and do assessments within a couple hours, and they try to find the least restrictive mental health placement for your child. It could potentially mean commitment, but it could also potentially mean in-home services. 911 is what you want to call if your child needs any sort of medical attention. If your child has self-harmed and you call Mobile Crisis, they're going to tell you to call 911 first or take your child to receive medical care. And then lastly, here's the Knox County non-emergency number. This is great if you know someone that you haven't heard from in a while and you're worried something may be happening, they can go out to their house and do a safety check. Okay, well, are there any questions?